Why are instances of colon cancer, particularly, on the rise, not only among the elderly but also increasingly among younger individuals? Today, let's delve into this troubling trend and spark a meaningful discussion. Stick around until the end for a rundown of the most prevalent symptoms of colon cancer that you might be encountering. Colon cancer stands as one of the most devastating illnesses today, ranking as the third most frequently diagnosed and the second most fatal form of cancer. How do you recognize the signs of colon cancer? What are the early indications? Which symptoms signal advanced stages of the illness? And how can you detect it in its initial phases? What exactly entails a colonoscopy, and who should contemplate undergoing one? Moreover, what are intestinal polyps, and how can their progression into cancer be thwarted? It typically originates as a small, slowly proliferating polyp on the intestinal wall. Initially, it occupies minimal space and does not disrupt the intestinal contents, hence remaining asymptomatic in its early stages. Consequently, individuals at higher risk, particularly those aged 45 or older, are advised to undergo colonoscopies. This recommendation is even more pertinent if one has first-degree relatives with a history of cancer. With a colonoscopy, it becomes possible to visualize, detect, and remove polyps. The manifestation of symptoms often hinges on both the size and location of the tumor. Interestingly, colon cancer developing on the right side of the intestine can be more challenging to detect. Here's a tip for early detection. Tumors often exhibit disorganized growth, leading to imperceptible bleeding. One method for early detection involves analyzing stool samples for occult blood. A stool sample is collected and sent to a laboratory for analysis. Colonoscopies are also effective for early detection, but watch out for these warning signs. Chronic bleeding can result in iron deficiency anemia. If, around the age of 45 or 50, you appear paler than usual coupled with iron deficiency anemia, an evaluation for intestinal tumors is warranted. Sometimes, stool may appear darker due to slightly more intense bleeding. Now, let's consider colon cancer occurring on the left side of the intestine. Obstructions or intestinal blockages occur earlier in this region because feces are already solid, containing less water compared to the right side. So, what symptoms might a person experience? One common symptom is a change in bowel habits. If your typical routine involves daily bowel movements or once every 2 or 3 days, experiencing increased constipation recently, going without bowel movements for 1 or 2 weeks should raise suspicion. Additionally, alterations in the shape of fecal matter may occur. Thinning may occur as feces traverse this intestinal segment. Alternatively, you might experience episodes of diarrhea alternating with periods of constipation. Many individuals endure chronic diarrhea, prompting doctors to consider a colonoscopy to assess for the presence of an intestinal tumor. As the tumor advances, it may create an X-ray image resembling a bitten apple, indicating narrowing of the intestinal lumen due to the tumor. Consequently, feces struggle to pass through this narrowed section, and the tumor can cause bleeding. Unlike hidden bleeding in earlier stages, the blood here is often bright red and visible. Additionally, stool may appear darker due to blood presence, akin to right-sided colon cancer. Further symptoms indicative of advanced cancer include abdominal pain from obstruction-induced gas buildup, abdominal swelling, weight loss, fatigue, and chronic tiredness. Symptoms may also manifest in internal organs, such as liver pain from metastasis or shortness of breath if the lungs are affected. Hence, the subsequent information on early detection and natural prevention is crucial. This transformation hinges on a combination of genetic makeup and lifestyle habits, contrary to past beliefs. Our genes aren't fixed. Dietary choices and lifestyle habits can influence gene expression. A balanced diet and healthy lifestyle can dampen the activity of genes associated with chronic conditions, whereas poor dietary choices can accelerate gene activity, potentially hastening polyp growth and transformation into tumors over time. Risk factors for colon cancer. Several factors contribute to the acceleration of polyp transformation into cancer. Ultra-processed foods, excessive intake of red meats, particularly processed varieties like sausages and salami, harmful fats, excessive vegetable oils, except olive oil and select others, sugar, and excessive sodium all play a role. When consumed together, especially in the form of ultra-processed foods, these products act as catalysts for tumor growth. Ultra-processed foods have been officially recognized as carcinogenic for some time. Other contributing factors include constipation, poor or insufficient intestinal flora, microbiota, and chronic inflammation. Additionally, habits such as alcohol consumption and smoking are known carcinogens. To reduce the risk of colon cancer, maintaining a diet rich in anti-inflammatory and antioxidant foods is advisable. This includes consuming a variety of fruits and vegetables daily, along with spices like turmeric, which offer excellent anti-inflammatory and antioxidant benefits. Healthy fats such as omega-3s found in fish like salmon, tuna, sardines, and anchovies, or plant sources like chia, flaxseed, and sesame, are also recommended. Avocados and eggs from free-range chickens are other good sources of healthy fats. Addressing constipation by consuming sufficient water and fiber can also reduce cancer risk while improving intestinal flora. Now, let's discuss diverticula and diverticulitis. You may wonder whether it's safe to consume seeds, nuts, and the hard outer coatings of some seeds and nuts if you have these conditions. Contrary to popular belief, a comprehensive study involving over 47,000 patients found that consuming these foods does not increase the risk of diverticulitis or its complications, such as bleeding. Therefore, it is no longer recommended for patients with diverticulitis to avoid these foods. On the contrary, such foods can improve intestinal flora and function and may even help prevent colon cancer. However, each case should be individually evaluated. So if you have any intestinal issues, consult your doctor. What is colonoscopy? A colonoscopy is a procedure to detect colon cancer early. A tube with a camera is inserted into the intestine to find abnormalities like polyps or tumors. If found, they're removed and tested. Sedation ensures comfort. It's recommended at 45 or 50, earlier with a family history. Repeat every 10 years. Risks are minimal. Subscribe for more tips on cancer prevention. Thanks for watching.